Kendra, how are you today?
Good morning, Charles.
Awesome. So tell us a little bit about what you do and who you work for and what you guys are doing for diabetes.
Yeah, great. I'm with BrightSky, and BrightSky has been in business for about 12 years. We started as a home delivery diabetic testing supply service, and quickly realized as a part of that individuals living with diabetes needed help. They needed help 24 hours a day, 7 days a week. They couldn't always get to their doctor to see them when they had questions. They didn't necessarily understand why they were testing or what their numbers were. So we are working really hard to provide services to our members, online services, telephone services, in-person services sometimes to help them.
Now, are you finding that diabetics are taking this and really utilizing, or is it utilizing the services, or is it something that it constantly needs to be pushed and worked on?
Yeah, Charles, I'm having a real hard time hearing you, but yeah, I mean, we find that our members with diabetes who are on the phone with us sometimes several times a day or a month, they need help and they need support services that they can't always get, and they often feel like they're alone trying to manage their disease, and we want to be there for them.
Yeah, I've noticed that. Why is that, Doc? Why are they feeling alone? I kind of feel like that myself. I mean, basically everything that I've found out about diabetes has either been online, or because I've gotten into the diabetic realm, I've been able to find out and learn more about diabetes.
Well, it's difficult having a chronic disease, and even though diabetes is really common, there are a lot of people that don't have it and don't know about it, so it's not the kind of thing where you can just go to your next-door neighbor and expect that they're going to have the same experience as you do. But I think that as we can work together and to build communities and to form relationships, and, I see it with my patients when someone makes a comment in the morning, and I say, God, I wish you could have told my person the patient that I saw yesterday, because they would have loved to have heard that. And as physicians, a lot of times we do have to protect our patients' confidentiality, so we're not always able to facilitate those types of discussions, but you see it in your mind, and you see where one person could certainly help another individual.
Yeah. Kendra, can you tell us a little bit about the benefits of what somebody would get coming through your service or your online site, or some of the information that you guys put out?
We offer home delivery, obviously, of diabetic testing supplies and all chronic medications, so we can supply really a convenient service to individuals for the basics of how to manage their blood sugar by testing, as well as whatever medications may have been prescribed by their physician. And we really try to reinforce the physician and help them when they only have the opportunity to see their patients a couple of times a year sometimes, and we try and help in between those visits with those patients to make sure that they're testing, that they're taking their meds, certainly that they have access to them. We also have a full suite of online services, everything from nutritional education to activity and exercise, ways to track your blood sugar, your activity, your weight, your mood. We were just talking a minute ago about, connections and created communities. We have an online community inside of our portal, BrightSky.com, that our members can connect in a variety of different, what I might consider small groups, so groups that are focused around the newly diagnosed, or, somebody who may be struggling as they're getting older, or, they've had a life change and it's caused a change in their ability to manage their blood glucose. They can get together online and have a conversation.
Exactly.
Those conversations are, really, they're public in such a way that anybody who's a member of our site can see them.
Yeah.
The members can be anonymous so that they don't have to, expose their true identity. Mm-hmm. And we also have those discussion forums moderated by a variety of members of our staff. We have diabetes educators and nutritionists on our staff that help our members via telephone and also online, answer questions and the like.
And that's really good, because like I said, the first thing I did, and we live in a day and age now where people go online, and I did go to some forums, and unfortunately, boy, if you say the wrong thing in some of those forums, you get attacked like a pit bull in those places.
You got a witness.
So the fact that you guys allow a forum that is something where you can get some answers and hear from some other people. Hey, we've got a